Hi guys, welcome to day 12 of the Arora AKT 30-day challenge. I hope you're having a good day, whether you're watching this in the morning, afternoon, evening, or whether you're watching a whole bunch of them back to back at a future date. Hopefully you're finding the previous ones of some value. If you are watching this and you are finding them of value, please do give us a like, a share, or a comment, whether you're watching on YouTube, Facebook, Twitter, Instagram, LinkedIn, or wherever else you happen to find this video, and wherever you are in the process of your AKT preparation. So we're going to go into another clinical question very shortly. You know the drill by now. We'll give you 57 seconds to have a think about the question. Think of it both from the angles of clinical, how much do I know, but also technique, how much can I work out, even if I don't know, because it may be a topic that you've not read or not covered, and you plan to go over at another point closer to your exam. So let me get the clock ready, and hopefully we'll be able to teach you some good stuff. Thank you for all the kind words that have been coming in and the comments. I do read everyone. I do try and reply to everyone if I can. And I'm just getting my timer up. Okay, 57 seconds. Let's go into the question. I will go quiet. There's your time, guys. 57 seconds, as always, goes fast, particularly in questions like this where you've got to do a lot of thinking, a lot of stuff to read, a lot of knowledge to bring back, and then a lot of technique to bear in mind as well. So let's look at this. Smoking cessation, something that you probably don't do very much of in real life. Of course, in primary care there are lots of smoking cessation services and clinics, and we often direct or people get directed to these services. And if you're in secondary care, then again this might not be something that you've looked at, but it's something that is primary care based and can come up in an exam like AKT. So a 21-year-old patient comes in to see you regarding smoking cessation advice. He has no past history of note. He smokes 10 cigarettes per day and has done for the last 4 years. Which of the below statements is most incorrect? So again, double word here. Change most incorrect into a single word. Which statement is false? Make it easier for your brain, less to worry about, less to stress about. This is something that you guys will know by now, having watched the previous questions that we've done and also attended our courses. So the answer is C. C is the most incorrect or false statement. He could not be prescribed varenicline if he had a history of a psychiatric condition. Now, that is a false statement because he could be prescribed varenicline if he had a history of psychiatric condition. Now, sometimes when you're reading through this question at speed, particularly when lots of things are going through your mind and you may have just maybe skimmed over smoking cessation, then your brain is going to make matches between varenicline and psychiatric condition because that is probably what you read about, potential links with things like depression, with varenicline, suicidal risk, etc. And therefore, just reading varenicline and psychiatric condition might be strong enough, your brain might be strong enough to kind of fix that in, even though we may not know for sure. And also, we may miss, therefore, the word could. Now, could is another example of what we call a soft word. So he could not be prescribed varenicline if he had a history of psychiatric condition. It's not a must or must not. It's kind of in that middle zone. So whenever you go to soft word like may or could or can, then it kind of shifts things up the potential true ladder if you're looking at it from a pure technique point of view. So obviously when you do prescribe varenicline, we'll go through this in a second, you do need to be cautious of history of psychiatric condition, but it's not a contraindication. There are only two contraindications as per NICE-CKS, one age under 18 and second those with end-stage renal disease, and we'll talk about these in a second. So that is an incorrect statement because he could be. In certain situations, you could prescribe varenicline in someone with a history of a psychotic condition. The others, however, are all true. If he asked to use varenicline alongside nicotine replacement patches, you would need to say no. That is a true statement. You would need to say no. There are 3 types of smoking cessation therapy, which we'll talk about in a second, but you cannot mix any of them together. People often think that, alongside varenicline, let's just have some patches as well. Let's just kind of double up the effect, but you can't, according to the guidance. B is true. If using bupropion, then an 8-week course would meet NICE CKS guidance. So NICE CKS guidance suggests a 7 to 9 week course when it comes to bupropion, which is different to varenicline. Again, we'll talk about these in a second. That's true. D is true. If using bupropion, then a common side effect to advise would be insomnia. Yeah, very common side effect, insomnia. In fact, can happen with both of the medications. So insomnia is true for both. And E is true. If prescribed varenicline, his ideal dose for the majority of his treatment would be 1 milligram BD as per NICE CKS. And as we'll discuss in a second, you start at a lower dose, you gradually increase, but the main dose you're aiming for, as long as they haven't got things like renal impairment, is 1 milligram BD for the majority of their duration, of course. So C is the answer here. It's the most incorrect, i.e. the false statement. The rest are true. So what do you need to know about smoking cessation? So I guess worth going over the classic withdrawal symptoms when it comes to smoking, just in case you get a question on this, and it's just there for you to pick up. So obviously nicotine craving can happen, increased appetite, restlessness, depression, poor concentration, irritability. There are others as well, but craving features are things that often come up in question, or withdrawal symptoms may come up in questions in your brain. Remember, we'll think about probably clinical diagnoses first. When you see a bunch of symptoms in a question, the first thing your brain will do is start thinking about which diagnosis fits all this stuff. Whereas actually things like withdrawal can cause a lot of symptoms that we may not think about to start with. And then you have the 3 methods for smoking cessation. Again, like we said, never in combination. Nicotine replacement therapy, so lots of different variations: gums, patches, lozenges, sprays, inhalators, sublingual tablets, varenicline, and bupropion. So a bit of detail about these 2 medications then. So varenicline, well, with both of them actually, the whole point is that you plan your stop date in advance, and you kind of say, well, I'm going to stop smoking in 7 to 14 days. This is the date, and the aim is that you slowly increase the medication so that by the time you actually stop, you've got enough medication to do the work that it's supposed to do. It's not that you start the medication today and you stop smoking today, because you won't have enough to actually deal with the cravings and the consequences of stopping. So plan your stop date, and you start the medication 1 to 2 weeks before. Like we mentioned, you gradually increase the dose up to 1 milligram BD. So by the end of the first week, you're around about this dose, and that then continues for the duration. Remember, if in renal impairment, then you make sure the dose is slightly lower. The usual course for varenicline is 12 weeks, slightly longer than the bupropion. But then once you hit that 12-week point, then you don't need to taper the dose. You can just stop. Like we mentioned, not in under 18s and not in those with end-stage renal disease are the only 2 contraindications. There are lots of cautions, but these are the 2 contraindications. And going forward, you monitor lots of things like, for example, mood, suicidal risk, and things like sleep, because like I mentioned, insomnia can be a problem with varenicline. Then bupropion, probably the one that's not used as much, but certainly to know it as an option in primary care. Again, plan your stop date and start the medication 1 to 2 weeks before. Similar process to varenicline. Usually the dose is 150 milligrams once a day for the first 6 days, and then 150 milligrams BD thereafter. And like we mentioned, it's usually 7 to 9 weeks. You don't need to taper the dose, just like in varenicline. You can stop it at the end of your duration. Can't use it in a number of different situations, so make sure you look out for these if they come up in questions. Any kind of history of seizures or seizure-related conditions, any kind of central nervous system tumor, history of anorexia or bulimia, hepatic cirrhosis, or a history of bipolar disease. So these should kind of stand out as red flags almost if you get them in a question, and one of the options is bupropion or varenicline if you're looking at the contraindications here. So quickly to review this then, so like we said, A is a true statement. Like we mentioned, if he's asked to use varenicline alongside nicotine, we should say no. So if they ask can we do it, you should say no. B, bupropion, then an 8-week course is as per NICE CKS guidance. C, like I mentioned, is false, because he could be prescribed varenicline, not could not. If using bupropion, then a common side effect is insomnia. Remember that for both medications. And then if prescribed varenicline, his ideal dose for the majority of treatment would be 1 milligram BD as per NICE CKS. So guys, hopefully again you picked up a couple of technique-based things there, as well as knowledge-based things. Smoking cessation is not often things that people go into detail with, but it's something that I would learn for AKT for sure. A few words about our mock exams. If you're finding these types of questions useful and stimulating in terms of both knowledge and from technique, then you'll find our 5 mocks of value. There are 5 separate mocks that you can get as a discounted bundle. There's a triple bundle that you can get 1, 2, and 3. And then you can buy any of the 5 individually as well. 1, 3, 6, or 12 months. Make sure you use the coupon Arora Video 10 for a 10% discount. There are a couple of things on here that actually I think will help boost your prep for the remaining X number of days before your exam. Number one, the questions are quite challenging, there's no doubt about it. We set them at a level that pushes you, because I think that's what you need, certainly at this point before your exam. You can add extra time if you need them in the exam, because some people do have extra time for the real AKT, and you can match that exactly the same. The set out is the same in terms of flag questions and going back, etc. The timing is already the same. But the main things of benefit are the explanation, because we, like I said before, we work very hard to make sure that we focus your teaching based on 5 points per question. So each exam gives you 1,000 learning points. If you get all 5, you have at least 5,000 high quality, focused, non-waffly take-home learning points that could come up in your exam. But also your breakdown of the paper is split into the sections, so you know exactly what you need to work on going forward, and you can repeat each mock as many times as you like, and every time it re-randomizes it, so you can't kind of go by memory, because as we know sometimes happens when you repeat questions again and again and again. So please do that. Use that coupon Arora Video 10, not just for this, but for any AKT product that we have on the website. The coupon is there for you to use, so please do take advantage of it. Hopefully there's been some value. Smoking Cessation, I would go and learn if you haven't, and hopefully we've given you a kickstart today. See you tomorrow for day 13. Hashtag Campus Will Pass. Hashtag I went with Arora. Have a good day.